I hope everyone is well. I hope everyone is staying safe, wearing masks, and faring well under the strain of what is obviously something we've never seen before. We have as our special guest tonight, Congresswoman Bonnie Watson Coleman of the 12th District of New Jersey. And then we have some of our regulars, of course, Manager Bob Vornlacher, Councilman Ram Ambasarian, our super, John Ravalli, and our press, PJ Parker, Bill Bowman, and Malik Lyons. And our freeholder, Chanel Robinson, was in there for a little bit.
I'm here.
Oh, she's here, okay. So the Congresswoman's time is very valuable. So Congresswoman, do you have anything you'd like to say?
Yes, Mayor. First of all, I want to thank you for having me be able to have this conversation with you and my friends in Franklin Township, and for Freeholder and everyone else that's on the call. These are really difficult times. I recognize that this is unprecedented. Like you said, we've not experienced this before, but we're holding on, even though New Jersey is the second hotspot in the nation. I'm grateful to the governor. I'm grateful to his leadership and his thoughtfulness as we look to what stage we're in right now and how we're going to move through the various phases so that we can open up New Jersey for people to go back to work and for people to be able to socialize, et cetera, but we're not there yet. We did an initial bill the moment that the virus was, we were alerted to it. And that bill there was about testing. And then we did an interim bill. And that bill, we did a full COVID bill, which was about testing, supporting our hospitals, making sure that people had the PPE, the protective equipment, making sure that small businesses had money that was allocated to them so that they could keep on running. We extended unemployment and we provided $2,000 check, $1,200 checks and $500 checks directly to adults and to children who were eligible. We were fighting mightily because it was never intention by the Senate to do any of these sort of worker and family specific supports. But we succeeded in putting hundreds of billions of dollars in the first bill that would directly go and support hospitals. It was also supposed to support state and local governments. But the problem has been that a good portion of what our states and our municipalities are experiencing, which is making it difficult for them to meet their obligations, is not a result necessarily of COVID spending, but as a result of the revenue loss associated with settling in, sheltering in, not working, businesses closed, et cetera. You're not getting the revenue that you would ordinarily get. And the guidance that came down from the Treasury Department is making it difficult for some municipalities and for some states, including our state, to be able to spend down some of the money that came to them under the coronavirus bill. And then there was a recognition that all of the money that was put into the bill for the small businesses was being gobbled up really quickly, and in some instances, legally but inappropriately, by some of the larger, and shall I say, greedier businesses that had relationships with institutions and could get their applications processed quickly. Some of that money we're actually trying to get back, but it was quickly understood that smaller businesses and nonprofits weren't getting at the money. So there was an interim bill that was passed, and originally the Senate proposed just putting another $200 billion in for small businesses. And we negotiated more for testing again, more for hospitals again. We also had a carve out of $60 billion for very small businesses and for some of the nonprofits which weren't getting in on the original bill. Now we are putting together the latest iteration. We call it CARES 2.1 bill. And we are talking about what should be in that bill. And here are some of the things that the Democratic leadership and the Democratic caucus have agreed to. Number one is that we've got to go big, because we've got to go in support of the states, predicated upon what they really need to be spent in a manner that addresses how they lost their revenue, not just COVID costs. We need to be able to give directly to municipalities and directly to counties without having to go through the states in order to get your money. And it's got to be money that's in addition to what is set aside for the state. So we're not trying to carve out money from the state so that you get something that you're entitled to, but that you'll have your own pocket of money in this next bill. We're still committed to robust testing, because unless we test more, you're a doctor, you know, the more we test, the more we're going to find that the virus is around. The deeper we go, the more we're going to see that people are affected or infected. And so testing and contact tracing are going to be big elements of the bill going forward. We recognize the impact that this settling in, this sheltering in and not going to work or losing hours has been on families. So we're looking at rental and mortgage relief that will be forgiven, not loans, because the last thing we need to do is to tell someone you don't have to pay rent for 4 months. And then when the pandemic is over, okay, now you owe all that money in rent or mortgage. That's not going to serve our economy well, nor is it going to serve our families well. We're looking at another iteration of direct payments to individuals on a more regular basis, and to dependent children and even some dependent adults, like we did in the other bill. And of course, we're still looking to put more money into small businesses. We changed some language so that nonprofits of any size are now qualified as part of the small business program. And we're putting some more accountabilities into and language that represents the sentiment of the legislature as to how we want the money spent. And so we're actively in that discussion right now. And that may be something that gets voted on next week. I've been a part of a regional task force that Mikey Sherrill and Peter King from New York, who's a Republican, kind of created to look at the opening up of our region. It's Connecticut, Massachusetts, New York, Pennsylvania, New Jersey, Delaware. And we're having weekly briefings by experts on certain areas about what constitutes a healthy start to opening up this economy. And I tell you, we're not there yet. Yesterday, I was in Washington, D.C. for our first in-house meeting, a committee meeting with the appropriations. And we had Dr. Frieden, who was a former CDC director, and Dr. Rivers, who was a scholar at Johns Hopkins. And we talked about the elements that have to go into a safe opening and a gradual opening. Dr. Frieden kept talking about it's not an on or off switch, it's not black or white, it's a dimming. It's a dimming, and then we have to approach these things sort of in a phase and in a thoughtful manner that is supported through testing and contact tracing. The governor's put together his 6-point plan. I know you're well aware of it. He was on our call with the task force and sort of went through his areas that he thinks that the state needs to address before we can open up. And they're fairly consistent. As a matter of fact, just about every medical expert that we've spoken to, every public health policy expert that we've talked to, and then the governors are talking about the same thing. We've got to do more robust testing. We've got to find out what the contamination rates are as a result of those who have been found to be infected. We need to make sure that we have sufficient supplies of testing equipment as well as PPE. We need to be testing everyone that is showing symptoms and everyone who is a frontline worker. I've been working on a couple of bills that I think are important in this whole discussion, having to do with what we call essential workers. I know we keep calling our nurses and our doctors and people who are working in the hospitals our heroes. They are most definitely our heroes. But you know, so is the guy the woman or the guy who drives that bus or that train, who delivers our packages, or who works in warehouses putting packages together that are ultimately going to get delivered to us, and those who are delivering our food. These are all essential workers, those who are working in shelters. I've authored a bill that identifies them as essential workers and establishes a hazardous pay scale for them, as well as worker site protections, because we need to make sure that they have all the PPE they need, all of the workplace is sanitized. If there's a contamination, they have to be able to be released and quarantined for 14 days without having to lose any income. And we need to have strict OSHA standards to keep them safe. So that some of that's going to be part of the bill that we're talking about right now, but it also end up being a standalone bill. I think what I want to communicate to you and to everyone that's on the call, most of all, is that we don't know how long we're going to be sheltered in. We don't know how long it's going to take for us to move forward on this, and we don't know all of the costs associated with it. But we have to be committed to it and obligated to it, because we can't open up this economy unless the people who live and work and socialize in it are safe. And we can't open it up until they're confident that they're safe. And that's going to take time, that's going to take effort. It's going to take hiring people to be the contact tracers, the testers, the folks, the resource folks who are going to follow up with the people that need to be quarantined. We have to find alternative living arrangements for people who need them when they are quarantined. It just goes on and on. I don't think that there's any part of what we experience or what you experience as an elected official, or what policy folks experience when they think about a holistic community that's not being touched by this pandemic.
Thank you.
So with that, with that, Mr. Mayor, I will try to answer questions.
Okay. Well, thank you, Congresswoman. The things I want to highlight about what you said are testing, testing, testing. It's so incredibly important. It would be like driving your car without a windshield if we don't have sufficient testing. We're blind in many ways because there's many things about the virus we just don't know, we don't understand. But testing and proper testing is very important. Some of the tests that are out there are not very accurate. We're learning that now, and that needs to be fixed. And then the first responders, or I'm sorry, the essential workers, the heroes. I think of the woman or man who works the cash register at the grocery store.
Absolutely.
Without them, I don't eat. And they're there at risk. I mean, they're at risk as much as people in a hospital, because they have many, many people coming up in front of them. When I'm in the hospital, I'm in control of this person, and I'm in control of the distance, etc. But they're much more vulnerable. So my hat is off to them. And thank you for bringing that up. So we did have some write-in questions. One person sent in 3 questions. I am not going to read them all because there are other people waiting. He did complain that he had tried to reach your office several times and only got one response. But his other questions are, I'm going to kind of combine these. How do you feel about politicians utilizing or appearing to utilize their connections or influence to get their friends, family members, donors, etc., public sector jobs, and kind of related, but more specific to the virus, I think. There have been news reports about senators and representatives from both parties making stock trades in the healthcare, pharmaceutical, travel industries after closed door hearings. So what do you think about those kinds of things?
Well, I'll tell you what I think about that in the context of this pandemic and the bills that we have passed and the president has signed, and the trillions of dollars that have been associated with these bills, and the jobs and the contracts and purchasing of the PPE and other supplies and things of that nature. This is not about cronyism. This is about people who are qualified to do what it is we need them to do in these unprecedented times. And if they're contractors, they need to be legitimate contractors. We are finding areas in which there has been some cronyism. There have been donors and friends associated with this administration who weren't necessarily ever working in this space before, but because of their contacts, they've been awarded contracts. That's under investigation right now. And so if the person who's asking this question has a concern about what is happening with this pandemic and all of the trillions of dollars that are going into making us whole and healthy again, then I want to assure that person that the Democratic caucus has been fighting like hell for language in every one of these bills for accountability, but that we're fighting against a Republican controlled Senate and an administration. And in the first bill that went out, there was over $500 billion that was given to the treasurer and the president, I might add, to dole out to whatever daggone business they wanted to, with very little accountability. And every effort that the Democratic caucus has tried to employ to ensure that there's some accountability, we get pushback. So I hope that answers your person's question and concerns.
Specifically, he asked about I guess, the law passed under President Obama in 2012 about insider trading laws.
Insider trading is an issue. It has been identified, and there have been members who have left office and are paying their debt to society because of insider trading.
And then, well, I'm going to ask the question, what is Representative Bonnie Watson Coleman's stance on Trenton City Councilwoman Robin Vaughn's homopathic statements?
Okay, in general, there's no place in this society for homophobic, racial, or anti-Semitism. That's not who we are supposed to be. Specifically, I've already addressed that issue. And Mayor, quite frankly, I don't really think that that's something that I need to get into. If you want to see what my statement was, go to my webpage, go to my Facebook page and see that. I've already spoken out on numerous times against the use of anti-Semitism, racism, or homophobia.
Well, thank you for your answers. Michael, do you have answers from the Facebook feed? I mean, questions from the
Actually,
Facebook.
we're going first to our local press outlets, and then I'm going to call for questions from the Facebook feed. And
Yes.
I'll remind everyone, as I have in the comments section, to hold your questions, because we will only be seeing the ones that are written after we call for them. And I'll first go to the Franklin Reporter and Advocate. Will that be PJ or Bill?
PJ.
PJ, go ahead. You just need to unmute. Here you go.
Let me see.
You're good. You're good.
I'm good? Okay.
Yes,
Well,
ma'am.
thank you once again, Mayor Kramer, for hosting this meeting. And thank you, Congresswoman Watson Coleman, for attending. My question has to do with today's announcement by Governor Murphy that the National Guard is about to be dispatched or has already been dispatched to long-term care facilities. And I'd like to know what your comment is on that, what you think its presence, what the impact of its presence is going to be, and what exactly is their role in their presence.
I'm sorry, I can't answer that. I have been on on interviews and Zoom calls and web texts and everything else since 8 o'clock this morning. So I didn't see the statement. But I know that the long-term care facilities have had a tremendous challenge. That we've had deaths, we've found bodies that they didn't know what to do with. So I suspect that the National Guard is in there to facilitate a healthier and more cohesive strategy as it relates to dealing with that population. But I'm sorry, I haven't seen it, and I really can't comment beyond what I think it might be.
I can comment a little bit on that peripherally. They've actually been at my hospital for a week. They are supplementing doctors. They're just adding to the workforce. I don't know that that's why they're at the long-term care facilities, but that's what I suspect.
Yeah. Well, those are the facilities that have really been hit very hard. And I know that the National Guard is providing staff support in various places. I mean, from the kitchen crew to the whatever. So I would suspect it's in that vein.
That is correct, Freeld Robinson. So Mayor and Congresswoman, both of those answers are correct. That's what they're in there for, to shore up the facilities and the staffing that is needed as those facilities are taking a big hit.
Great.
Thank you, Freeholder Director.
Okay, thank you. Thank you for your responses.
Bill?
Okay, thank you. Welcome, Congresswoman. Nice to see you again.
Thank you. Nice to see you.
My question is talking about the bill that you said you and some other folks are working, I guess the leadership and in the House and the House members are working on, and you expect to have a vote on it next week. Given the situation in Washington and given past history with Republicans and Democrats, or recent past history, what are the odds of this bill even passing, do you think?
Well, I think that, no one ever gets everything they want. So we'll find a bill that ultimately has some sort of a compromise. Nancy Pelosi and the leaders of our committees, including Frank Pallone, who's doing an incredible job out with energy and commerce, are putting together those things that we think are absolutely essential. And they are meeting with their Republican counterparts. And we are hoping that anything we come out with is bipartisan. And we don't think that there's anything that we're advancing that they shouldn't be in support of. If their concern is to lift up the neediest, to shore up those in families and workers and communities that need our assistance and need our focus and need our prioritization. And then recognize that we have to help our small businesses as well, because they're sort of the backbone of our economy. So there's no reason that they shouldn't be willing to be a part of this effort. Certainly they're going to have some desires for maybe some other things, and they may not want to support all of the things, but we'll see where it goes. These are unprecedented times, and this is the time, and it's not about our politics. It's about the safety and security of our individual residents and the healthiness of our economy. That doesn't have a label on it. That's just right or wrong.
It would be nice if more folks on the other side of the aisle would think that. Given the outright abuse of that small business money that was I guess allocated in the last CARES Act, things like Ruth's Chris getting $20 million, right? Things like that. What safeguards have you put in to make sure that stuff doesn't happen again? Well,
first of all, they're trying to recapture some of that money, and either through shame or whatever, they are getting some of it back. I'm not sure about her specifically, but I know a couple of others have given the money back. But it's about language in the bill. It's about clarity in the statement what the money is to be used for, and clarity on what it cannot be used for, and understanding what the consequences are if it is abused. And so those are things that we've been trying to do in every one of the bills that we have been advancing, dealing with the COVID-19. We don't always succeed because Republicans just don't seem to have a desire to hold those that are already well-heeled accountable, while we quibble about over subscription and regulation of those who are on SNAP and Medicaid and, you know, things of that nature. So it's a fight that we have.
Okay, will that be all, Bill?
One more question.
Sure.
Given the tragedies and the outright disgrace that's been going on in some of these long-term care facilities in the state, is there anything on the federal level that you folks are looking at doing to kind of right that wrong?
You know, we're looking at putting resources where the resources are needed, but the regulation of those facilities and the standards under which they should run really is a state function. I think if anything, we are, you know, we're impressed by the fact that there may not have been sufficient oversight of the facilities. But I also think that, to be fair, some of these facilities are very good facilities that are just absolutely overwhelmed by their the people that live there being infected through community contact, visitation. So I think that everyone's going to be more strict in terms of sanitation and hygiene and things of that nature. I think that we all have a lesson to learn here, and that, you know, we talk about the different phases of opening up the economy. Well, one thing that we have to do, the Trump administration dismembered the entity that the Obama administration put in place to look forward, to look ahead at what pandemics might be coming down the road. Well, we need that again. We need that entity that does that research, looking for that disease X that's going to come along, because it's going to come along. We need to have infrastructure in place where we have some intelligent stockpiling of the kind of resources, whether it's the vaccines or therapies or medications that deal with the symptoms, or whether it's PPE and ventilators and things of that nature. We have to have a national plan. And so just like we have to have a national plan, states have to have state plans. And I think looking at long-term care facilities would obviously be one of them.
You say that it's mainly a state thing, but the CMS has something to do with it too, right? I mean, there was just a report out by USA Today Network in Gannett, New Jersey, that showed that 80% of the long-term care facilities in the New Jersey tri-state area that had COVID deaths failed infection control procedures for the past 3 years. That's a CMS thing. That's a federal thing. Well,
that's a CDC thing as well. Yes. Right. There's oversight. I mean, everyone has some responsibility here. But I think what's important is that we need to have we need to know. We need to have a federal plan, and we need to have a state plan moving forward, so that something of this nature doesn't happen again. And then the Department of Health that does the kind of inspections of these facilities has to have sufficient staff to be able to go into them on a regular and unannounced basis. And the Department of Community Affairs that looks at the boarding homes and the rooming homes where people who are generally more elderly, poor, in need of some services, but not all. We need to be able to have real-time inspections.
Okay. Always a pleasure speaking with you, Congresswoman. Thank you very much.
Great.
Thank you.
Bill. Thank you, Bill. Thank you, PJ from the Franklin Reporter and Advocate. Now I just want to go over to Malik Lyons from Tap Into Franklin. You're with us, Malik?
You're muted.
Sorry about that. Can you hear me now?
Yes, sir. Welcome.
Hi there.
Okay, excellent. Thank you. Thank you. Thank you so much, Congresswoman, for attending tonight. We really all appreciate it. Thank you.
Thank you. I'm glad
I
to
just
be-
had, thanks. I had a quick question for a couple of questions, but my main question is based on the feedback you've received from your constituents in your district, how do you feel the state has been handling unemployment claims in New Jersey?
I think that the system has been absolutely overwhelmed by the volume. I think that the state, I believe, opened up a new portal trying to deal with the volume. It's not a state of New Jersey problem. It's been a problem all around the country. And they are trying to ramp up hiring so that they have more people processing these claims. But not only has the unemployment issue been, a bit of a frustration for people, and I want people to know two things. Number one is if you're eligible from the very beginning. So if you don't get to talk to them today, what you're due is retroactive. And number two is if you're eligible, it may be frustrating, just keep at it, because they're doing the best they can, but they are trying to ramp up with additional staffing so they can process the claims more. But this is unprecedented. I mean, there are 33 million people on unemployment in this country right now. It's a lot. That's unfortunate too.
Thank you. Another question, with federal response to the COVID pandemic, do you see any kind of coordination between the states in regards to trying to slowly open their states, like things that people are learning from one state to the other? Is this type of information being shared and applied to New Jersey's 6-point plan of how we're going to open up our state eventually?
Yeah, there are these state compacts. There's the East Coast Compact. That's what I talked about when I said the regional task force that I'm on, but the governors are on a regional task force, and their various staff members are on regional task force, and it goes from Massachusetts all the way down to Delaware, because these borders are soft. I mean, you do one thing in one state, you relax something in one state, they can go over to another state and create a problem if we haven't done the appropriate measures in our state, or the state that's letting people become more socially and workforce engaged. And then there's also a compact out on the West Coast with California, I think, in Washington, and it goes down, and it might even involve some other states. They're looking at it comprehensively also. There are things that you're expected to do irrespective of where your state is. The whole issue of more testing, who you're testing, how you're prioritizing the testing, and how the testing has to be distributed, and how the supplies have to get there in order to be able to do the testing. The contact tracing, that's something that every state has to do. The quarantining and looking for alternative habitation sites for people who can't shelter at home. That's something that everyone agrees has to take place. Having resource managers to make sure that the people who are in quarantine are getting the things that they need, and maybe even a stipend to be quarantined. Those are principles of opening up the states that you hear from all of the public health experts, all of the scientists, all the folks who've been dealing with infectious diseases in their careers. So there are some principles that need to be applied. So the more rational and reasonable the state government is that we're talking about, the more cooperation you'll see. But there's such a thing as states' rights. And so you're not going to see the same thing in each and every state.
Yeah, that's actually what kind of what my point was. It seems as though like even if one state kind of tamps this down because of policies that are going to be held in another state nearby, that may negate anything that can be done. And I was just wondering if there's anything on a federal level that's being looked at to kind of really mitigate this as much as possible.
We're
And that
trying to
was
put
my
the
final
resource.
question.
Okay, I'm sorry. We're trying to provide the resources and the guidance to do the things that we think are needed in order to make these states and the people in these states, every one of them, and the territories, every one of them, as safe as possible. And it's trillions of dollars that we're talking about here, trillions additional dollars. Testing, 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 and contact tracing, and tracing and tracing and tracing are fundamental wherever you are. And you're seeing now that states that hadn't been engaged in a more rural states, you're seeing an upswing in some of their infectious rate because they're testing now. So we're providing the resources, but you know, there are places like Florida that are shunning people from New York to come to Florida. So, you know, states have bear some authority in who comes into their state, unlike the federal government imposing or trying to impose it sort of en masse around the country. Because we are the United States of America, and states have authorities that rest with them.
Thank you.
Thank
y'all,
you.
Malik. Thank you, Malik Lyons from Tap into Franklin. Now I'm going to ask that those who are viewing from Facebook can submit their questions clearly and concisely in the comment section of the feed, and I will take them for the Congresswoman.
And please, now, we're trying to allow people to ask questions. I know some people want to make comments. This is not the time for it. It'll make it too hard to pull out the questions. So please be courteous to others and allow questions to come through.
Absolutely. So let's see here. Can we please do something? I know you say you have reported to the governor's office, but yesterday, today, there's so many people down at the, okay, so this is more a local issue for the park. So we want to have questions specifically for the Congresswoman, but I think there's a question later for when, maybe Bob, when you report about clusters of people in the parks. Question about mortgages. With mortgages, why can't the lenders just move the missed payments to the end and no added interest? That way everybody wins. Any comment on some of the forgiveness of mortgage payments, or at least delayed payments?
Well, originally that was the thinking, that you would add on the mortgage payments to the end. However, we are figuring out a way, hopefully, to forgive renters their rent as a result of this pandemic. And so it seems to me for those that are of some income level, like you have eligibilities, should get that same consideration if they are struggling to continue to own their homes. We're not trying to overburden you in your older years. We're not trying to overburden you when this pandemic is over. We're trying to do whatever is necessary to make sure that we are whole again, whole and healthy, confident and safe.
Thank you,
And I think
Congresswoman.
I would add to that, everything you do in this virus has an effect in another way and hurts you in another way. For the Star Trek fans, I constantly am saying Kobayashi Maru. I won't go into what that means, but they understand that. It's just, sometimes there's no win, and you do one thing, you do the least bad thing, and you just have to be careful. There's unintended consequences. I think that's basically what the Congresswoman was saying. It's difficult. It's very hard.
So there's also a question related to any kind of relief for renters as opposed to mortgage payments. Is that
Yeah,
something-
I tried to cover that in
Okay.
my my briefing. There is a proposal that we are considering right now. There's already an opportunity to delay your rent if necessary during this, but we're trying to figure out a way to make sure that that rental that you weren't able to pay is actually forgivable at the end of this, and to make the landlords whole.
So
And so I'm on a bill with Congresswoman Waters, who's the head of financial services, and it is a bill that's advancing sort of $100 billion to address both rentals and mortgages.
So there is one question that might have been intended more locally, but I think might ask just in terms of supermarkets and other, retail outlets having kind of normalizing their supply lines and the ability to get certain items. Is there any sense of, when that might normalize?
The whole issue, the whole supply chain issue, not only our groceries, or you see what's happening with the meat factory, with the meat processing plants right now. That's going to affect how much meat you're going to have to be able to buy. We've had the issue with toilet paper and paper towels from the very beginning. I think these factories are working very hard to ramp up to meet what is the demand, some of which was a bit of a panic on our parts. I mean, including me, probably with the toilet paper and the paper towels. But I think everybody is working their hardest that they can to meet the demands, but it's going to take time. I mean, it's the same thing with the vaccines and the that are being tested out right now. And it's the same thing with having the therapies and the medications to deal with the symptoms of the virus, making sure that the supply, it probably would have been smoother and easier if the president had invoked the Defense Production Act across the board and early on, instead of equivocating. But we are where we are right now, and we're working our way back. I am due for what will be my 9th conference call of the day in 2 minutes. So I am going to have to wrap it up. If there's any last question, maybe. I'm sorry, I just got, while I'm on here with you, notice that there's a briefing that I have to be on.
Sure. Well, we certainly appreciate you spending nearly an hour with us. There's one question I'll pull that just came up. There's a question about status of extension of unemployment benefits here in New Jersey.
That's part of the consideration in the new bill as well. I don't know all the specifics of the bill. I just know the broad categories that we're trying to cover, but making sure that there's adequate unemployment insurance available is definitely one of them.
Okay. Well, thank you very much.
Thank
Bill?
you, Congresswoman. I was just thrilled when I found out you were going to be able to attend. It's always a pleasure to just chat with you, but it's a real honor, and you helped us understand more about what's going on in these very difficult times. Please stay well, and please keep up the good work. Thank you.
Thank you, Mayor. Thank you for having me. You stay well. I want everyone to be ready to come out of this and to go back to work and to enjoy our beautiful parks and other recreations and socialize. I just need a hug from my grandbaby right now, and I'm not able to get that. So I will keep you all in prayer. I ask you keep me in prayer. Thanks for having me on.
Absolutely. Thank you.
Thank you.
So the order of our agenda will take us through the updates of our panel, and we're going to start with Freeholder Director Chanel Robinson. If you have something from the county, Freeholder Director.
Hi, good afternoon, good evening. Thank you for this opportunity, Mayor, and your leadership here in Franklin Township. I will say we will continue testing at RVCC, and our testing has been done for Tuesdays and Thursdays beginning this past week, and we will continue next week. We just introduced a budget for the county. By no means is it etched in stone or the final count. However, my ask is that we go back to the table and see what else is there to make sure that we're doing all that we can to continue the services while maintaining the benefits to our constituents. We have certainly continue our calls. I'm on a call daily with the governor's office. Today, the governor actually memorialized another Franklin Township resident who had succumbed to complications from COVID-19. We continue to do all that we can to make sure that we're getting, as people are, the hot topic is the long-term care facilities, getting test kits and making sure that they have all that they need with regards to combating this pandemic. So that's all that I have right now.
Thank you, Freeholder Director. And our plan was to go through the panel and then we'll take questions from the local press. So the next up would be Township Manager Bob Vornlocker.
Thank you, Michael. I'm going to just address a couple things that I'm seeing on the Facebook feed, and I think I can do it rather quickly. There's been a number of questions about things like rental assistance. Should I pay my rent or should I wait for my unemployment? Things like that. So obviously anyone who's on Facebook right now has access to the internet, and I would refer them to the township's website. And if you go to the township's website, directly in the middle of the homepage will be a link to the COVID-19 hub for the township. And under resources for residents, a couple of things I'm going to just touch on. One, as far as there's a link to the state page for, are you a renter or a homeowner threatened with the loss of housing due to COVID-19? There's help available here. That link will bring you to the state page to give you advice and resources if you can't pay your rent. There was a question about SNAP benefits and would SNAP benefits be increased for those? So if you go to SNAP services under that same tab, the May payments for SNAP benefits are increased for an individual of $194 up to a maximum amount of $509 for a family of 3 or more. So there's information there on SNAP. If you don't receive SNAP benefits and you feel that you may now qualify for them, there's also the link on how to apply. There was also a question about home delivery of groceries, residents helping residents. The link is there again under the resources for residents. How do I get food from the food bank? Again, same place. There's a link there for the food bank that can bring you to their website and give you information on how you make a reservation to go pick up food. And just one other thing, that's because so I think I covered a couple things that have been on the feed. Another thing that's come up is just today I was told that there are people who are going to the police station looking to drop off items that need to be taken to the municipal building. The police department is not the recipient of documents that need to be sent to municipal offices in the municipal building. If you have something that needs to be delivered to the municipal building, we need you to contact the police, contact the specific office that it needs to be delivered to. If you don't get a response, I'm going to give you 2 extensions. 6208 will bring you to the clerk's office, which has someone in the clerk's office. That's their main line. If no one answers, leave a message. Someone will get back to you. And arrangements can be made for deliveries to the municipal building, but we need to make arrangements. The police department can't be taken in things like today. Apparently it was a marriage license application. It needs to go to the clerk's office. So 6208, that's the main number for the clerk office, and you can leave a message there if no one answers. And I'm sure there will be other things, but that kind of covers me for now.
Manager, I'm going to jump over to Councilman Rahman Barasan. If You want to unmute?
Michael, while he's unmuting, we'll remind me, we'll put up a post with the 6208 number.
Okay, fair enough. Councilman.
Thank you, Michael. Yeah, just wanted to give you a quick update. We have been putting out a lot of information about the concert to benefit the food bank. As you know, we announced it last week. We have made a significant progress. A number of social media postings have been generated, flyers, and so forth. Malik ran a nice story about the event. Thank you, Malik. There's a lot of information out there. We are excited. The group is practicing very hard. As a matter of fact, as soon as this is over, I'm going to join them, join the practice session. And I think there'll be a good selection of multiple language songs for about 3 hours. So we are excited. Please come and join us and donate generously. Food Bank, as you know, is serving about 1,300 people. That is up from 850, and they see no end of it. They are expecting to grow this 40% every month going forward until nobody knows when. So they need money to buy supplies and food to support our neighbors. That's all I've got, Michael.
So how does someone link to that, get to that?
Yeah, so the link has been announced on all of our postings, or if they just go to the food bank page that is on Facebook, there's the link right there. Just like how they find you, Mayor, on your Facebook page, they will find the concert on the Franklin Facebook page.
Great.
Great, thank you, Councilman. So now we're going to go to.
Can I just interject one thing?
Please.
Because someone just raised a question on Facebook that I think is timely to the thing that I just said. The reason why the lockbox for dropping off your tax bills and water bills is in front of the police station is because the police station is manned 24 hours a day and is under video surveillance in the front of the building so that the box is secure. That's why we don't put one in front of the municipal building, because clearly it's not. So you should put your tax bills and your water bills in the lockbox specifically designed for that purpose that's outside in front of the public safety building.
Thank you, Township Manager. And now, Superintendent of the great Franklin Township Public Schools, John Ravalli.
Thanks, Michael. Thanks, Mayor. Yeah, so Governor Murphy made an announcement earlier this week. I think we all know that. We posted a letter regarding it, closing schools for the balance of the year, which puts us on remote learning for the rest of the year. So many of our plans were underway in anticipation of such an announcement. So we are designing the final 2 phases of remote learning. Actually, we're working on the second to last phase and then the final phase. And we like to do it in phases because we're getting tremendous value in the feedback that we're getting from parents and teachers as well. So there was a survey posted earlier this week that we're using to help design this phase. And then there'll be another survey as soon as we open the next phase, a couple of days after, there'll be another survey that will allow us to inform the design of the final phase. So please look for those surveys. We appreciate it. We have plans underway. We have a committee working on details for plans that will allow us to safely celebrate the class of 2020. Mr. Schmiel and a large group of folks are doing a tremendous job. And they'll be detailing some of what we think that may look like in the next week or so. So stay tuned for that. We're also talking about maybe ways in which we could safely celebrate the 8th grade promotion, which is another milestone traditionally in not only our school, but most schools. We also are planning ways in which we can safely collect some of the items that we like to have back by the end of the year. And if we can do it, we will. And some of those things, I'll give you one example, would be music instruments, right? So we probably have 750 or so music instruments out there that we'd like to get back so that we can get them serviced like we traditionally do. So we're hopefully going to roll out a plan in the very near future that will allow us to do that safely as well. And of course, we need to get some personal belongings back to our students and our teachers alike, and we need to do that in a safe manner. So and what I mean by that is, our traditional locker clean out, which is a fun couple days at the high school and middle school every year. Obviously, that won't happen. So we've got some detailed plans on how we think we're going to be able to do that safely. Mr. Wilson and his department is working along with the schools to put the finishing touches on that plan. So lots of things will be out in the next 2 weeks addressing those items and more. If there are questions, please, I direct families to our website. Lots of answers are right on the website, but you can always call your school principal. And if there's not an answer, they'll find it. So we appreciate all of what the teachers have been doing. When, again, I can't say it enough, we appreciate our parents. Our families have done a tremendous job working with us through what's been uncharted territories. And like Mr. Logren will often say, as we're working on these remote learning activities, is we really are building this as we're flying it. And our families have been extremely patient. I just want to take the opportunity to say thank you, and thank you for the input. I think it's made a big difference in our phases, and our subsequent phases will be even better thanks to our families. So that's it for us.
Okay, thank you, Superintendent Ravalli. Mr. Mayor, did you want to show
Well, it
something?
looks like someone was asking the superintendent, the unused snow days in the calendar.
Yes, I'm glad you said that, because I had that written down but didn't mention it. So that will likely, of course, that's ultimately a board decision. We have to adjust the calendar at the May meeting, but it'll likely come off the last 2 days of the year. So we usually like to preserve the last day because, traditionally you want to have project graduation and graduation set a year in advance because of the planning that goes around that or circulates around that. But likely that's going to be a very different kind of celebration this year. So with that said, if the board approves it, we will likely be taking the final 2 days of the year. So instead of the last day of school being the 25th, it will be the 23rd.
Thank you, Dr. Ravalli. So
if and once
Mr. Mayor,
adjusted by the board.
Yep. So Mr. Mayor, we're going to have the local press ask questions of the panel, of any of the panel members, and then we'll move to the feed. So I'll ask people in the Facebook feed to hold their questions until the press have finished, and we will start with Malik Lyons, tap into Franklin.
Did I mess up again there, Michael?
Yes, but that's okay.
Forgive me.
Thank you, Michael. And this is for basically anyone on the panel. I was just wondering if there are any new things, and I know I brought it up last week, but I wanted to talk about it again, like anything that we could do for our long-term care facilities, like locally. I don't know if there are any, especially now that we're getting a National Guard, like to PJ's point earlier, now the National Guard is coming out to start helping. I don't know if there's any coordination being done on the local level, because it seems like that is really the hot spot where the majority, well, not the majority of cases, but the majority of fatalities are happening. I don't know if we're getting people at these facilities, equipment, or trying to help them, even maybe just giving them meals or so. I don't know, like it just feels to me as though these places are being left in the lurch in some instances. And in reality, it was the first place over in Washington that all of this type of thing started flaring up. So I just want to know if there's anything collectively that we're doing to kind of help them.
So as you alluded to, this is not just, well, this is a Franklin problem. It's a Somerset County problem. It is a New Jersey problem, and it is a federal problem. What we have done, and the manager can back me up and probably add a little more detail to it, is we have been providing PPE whenever they ask if we have it. And obviously there's limits to what we have of PPE. Do you have more details on that, Mr. Manager?
I mean, just to add to it, so there's been a number of things that have been done at the local and county level. Certainly, the County Office of Emergency Management has procured a large amount of PPE, and the major recipients of that PPE have been long-term care facilities in the county, including Franklin, that has received a good deal of it, and the hospitals well, the one hospital in Somerset County in Somerville. As well as first responders, police departments, first aid squads, and the like. As far as what can be done, I mean, we monitor the activities, as does the county daily. Reports are done by the individual managers of each long-term care facility on their needs. We monitor those reports every day. We have frequent telephone communication. And things like food, I mean, certainly, there are food service providers within each of these facilities, and there's staffing, and the staffing issues are monitored as well. There's now been an agreement, I'll call it, between Somerset County and a temporary healthcare worker service, that if in the event that one of our long-term care facilities needs people in short notice, they're able to provide them on a daily basis if there's a need. However, staffing has not been an issue, as it's been reported by all of our long-term care facilities. Remember, when we say long-term care facilities, everyone thinks we have 6 long-term care facilities in Franklin Township, but it also includes group homes and other residential facilities. So in the short term, Procure falls into that category off Cedar Grove Lane. And there are a number of facilities that we monitor. It's not just that we monitor 6, we monitor, I think it's about 48 in Franklin Township. Now, the attention is to the long-term care facilities, because the population in long-term care facilities is by their very nature vulnerable to this type of illness. So that is, you see the numbers that you see, and that's that the population before this even happens is a vulnerable population. So it's I guess, and it's to be expected to some degree, because by its very nature, the people who live there are frail. So, and this is a horrible, horrible, mean disease. And that's why I think we're seeing the numbers that we are. But as far as doing things, I think that the municipality and the county have, by the communication with these facilities, done all that we can do. We try to, when we can't procure it ourselves, we try to locate vendors that do procure, that do have supplies on hand, and provide that information to them. And we'll continue to do that.
I would just add.
Yep.
Go ahead, Field Director.
I would just add, Mr. Vornlocker is absolutely correct. The only thing I would add is that we have been pushing for test kits for the long-term care facilities in the county, so that they can have testing of their residents as well as their staff. What comes with that is not only procuring and securing test kits, but even having a contract so that they can get the results. So we've been pushing for that, in addition to making sure that they have the PPE that they need. They do have a means of getting additional staff if need be. I know some areas outside of Somerset County or even Franklin Township are having a much harder time with staffing than we are. And that was the need for the National Guard coming in, and they are here to shore up, whether it's physicians, nurses, cleaning the facilities, managing inventory of PPE and things of that nature. So not sure how much or what the public themselves can do. You may want to reach out if there's some of these communities that are sending food over, but I would certainly reach out and ask the director of those facilities what it is that they can get from the public or would need from the public. Other than that, Mr. Vornlocker is on point that the municipalities, as well as in conjunction with the county and with coordination with the state, has been doing all that we can. And we do recognize and realize that they are a vulnerable community or demographic. And we don't take that lightly.
And I have personally acquired donations, been involved in donations of thousands of pieces of PPE, much of which has gone to the long-term care facilities. And as the manager alluded to, they are a perfect storm. You have frail people in close quarters. It's just a horrible situation.
Thank you, Mr. Mayor. Malik, did you have additional questions?
Yes, earlier we were stressing the importance of testing, and I believe Boundbrook, I'm not 100% sure, and I feel so bad bringing it up because I think I saw a headline saying that there was going to be testing in Boundbrook. With that said, are we planning on bringing any kind of testing locations to Franklin Township, or will it still just be handled on a county level at RVCC?
So there was a pop-up walk-up clinic for those who do not have access to a vehicle. While at RVCC, you can only get testing with certain criteria, which one being drive-through, no walk-ups. I know Mr. Mayor early on, I think about 2 weeks ago, maybe my time is off, had asked about a possible clinic in Franklin to address the needs of those who would normally be left out of the population of having a drive-through testing or access to drive-through testing. So we will be looking at, from a county perspective, additional areas to do a pop-up walk-through clinic. So I hope that answers your question.
Yeah,
Yes, it does. Thank you.
And remember, the freeholder director is not likely to ignore Franklin. She lives in Franklin, and she lives close to people who need these facilities.
And we're the gem of Somerset County, of course. But Malik, did you have additional questions?
No, and this is the final question. Is there anything that the community members could do? I know we have, like, on the website, the township website, and they have so much information, like even things that people could do from home. Like, there's tons of information on the township website. It's a great resource. I was wondering if we were going to do anything a little bit more with some of the businesses. I know we have the restaurants, like a restaurant directory. Are we going to do anything else similar to that, to kind of thinking about that with the slow opening of the economy, with thinking about having some other sections on the website that could help kind of promote our small local businesses?
So the mayor and I were just having this very same discussion just before this event started tonight, and how there's a number of different, so the EDC has the possibility of some grant money for businesses, but also for municipalities to promote economic development post COVID-19. We have some CDBG grant money that is due to us that is specifically related to COVID-19, that's above and beyond our normal CDBG grants, but we haven't gotten all of the guidance from the housing and urban development people yet on that. And then I said to the mayor, I said, I think that one of the opportunities that we'll have as we begin to emerge from this, and we'll work with our economic development director, is to try to promote those local businesses as they begin to emerge from the shutdown, and try to push all of that information out, like we did with the restaurants that went to takeout and delivery. So those are definitely things that are talking points right now as we look to hopefully come out of this. So yes.
You have to understand, and this goes towards a question that was mailed in as to what we're doing for the small businesses. There are limitations. The Constitution of New Jersey actually prohibits municipalities from gifting to businesses or certain individuals. And you can imagine why before COVID-19 you would have that, because a corrupt government would be giving their friends gifts inappropriately. So that is generally a state and federal function, but we are going to be looking to not get around the law, but look for opportunities to allow us to do those things, as the manager just alluded to. Go ahead, Michael.
Okay, thank you. Is that it, Malik?
Yes, thank you.
Thank you, sir. And then I'll open it up to Franklin Reporter and Advocate for any other questions for the panel.
PJ, did you want to have something? You had something you want to ask? Yeah, unmute yourself.
I got you. Go ahead, PJ.
Good, PJ.
Okay, this is for Freeholder Director Janelle Robinson. I'm going back to the National Guard scenario again. Someone I know mentioned having a parent in one of those facilities, and in trying to prepare her for the presence of the National Guard, she became terrified. I'm wondering if their presence is going to be obvious, such as uniforms, and will the personnel be armed?
I do not know that detail, but I would not suspect that they are armed. They're there, they're physicians, they're nurses. They're there to shore up the staff that are there. I can certainly find out. I'm sure the perception of the National Guard being there or coming in emergency situations is usually when there are great storms, there's looting and things of that nature. This is not the case, as well as far as what their role is. But again, these are physicians, nurses, someone to help manage the inventory of the PPE, deploying the PPE. So those are the roles and types of members of the National Guard that are here to shore up those long-term care facilities.
I can answer that in part, just at JFK Hospital. They are wearing uniforms, and those uniforms are designed properly to protect them, but there's no firearms.
But it's an obvious military presence.
Yeah, and I literally applauded them. I saw them walking down the hallway. These are brave people coming here to do these things.
Yeah.
And they're on order, so I would suspect that they would be in uniform, just drawing back from military days.
Yes, of course.
Yeah.
And I guess I have one more question, and this may be the state's province, but now that the parks are open, is there the next wave that the township is considering as to the type of business might be eligible to open during the next round of opening?
So that's up to the governor and his team. I think there's been some chatter about it. They're certainly beginning to talk about it, but Freeholder Director, do you know any more things? I mean, nothing official that has come to us.
Nothing official. He was the one that put down the order, so he's the one that can reverse it and reopen. But certainly we all have recommendations and suggestions from across the state. All elected officials are chiming in. So I'm sure those ideas, suggestions, and recommendations will be taken under advisement. And as he announced earlier, I think it was last week, again, my days are fusing together, his commission to look at how to reopen.
Okay.
Thank you,
Thank
PJ.
you very
Bill,
much.
did you have anything?
Yeah, excuse me. Yeah, I do. Dr. Rivali, you haven't said the word prom and any of the things that you've been talking about for the end of the year celebrations.
You're a little hard to hear, Bill.
I'm hard to hear.
PROM is the operative term, I think.
PROM, yeah, how's that?
John?
Yeah, I was going to say, Dr. Rivali, you haven't used the word prom in any of the.
Are you asking me to prom, Mr. Bowman? The answer is no. I'll go with PJ, but not you. So yeah, that was discussed, and in actuality, there was some discussion about, and what the advisor, under the advice of the kids, has done is he's looking to try and move that to a later time, perhaps later in the summer, or maybe even another time where that could be done when kids may come home or whatever the case may be. But the idea of a virtual prom didn't seem to be of large interest with the class of 2020, at least according to the advisor. And he had over last I spoke with him, there was, more than 50%, probably closer to 65% of the kids in a Google Classroom that were responding in that way. So both the prom and the yearbook signing, which I also didn't mention, because I mentioned those both last time, there seemed to be a larger interest in creating a later date for something like that, which we certainly will be working with the advisor to try and do. But, the complication around commencement is something that the larger focus is on right now.
And who's the prom advisor?
The grade 12 advisor, his name slips my mind right now.
I asked the hard questions.
That is a difficult one when you're dealing with 1,100 staff members, yes.
And Freeholder Director, I think I may have asked you this last time, but I just wanted to follow up. How are you? Are you satisfied with the level of response to the drive-through testing or collection program?
Yes, I am. We're averaging a little bit 100 or a little bit over 100 residents between Hunterdon and Somerset County appointments per day that we're offering testing. A little bit more than 50% are actually showing up, and our test results are coming back within 2 to 3 business days.
There was one day last week that you had 48 people.
Yes, and then that's when we were nimble enough and responsible enough to actually have the testing done 2 days a week versus 3 days a week. We do not want to waste resources or people's times.
Okay.
But that may be a result with the universal testing for all residents in the state of New Jersey at the 2 FEMA sites, whether you're asymptomatic or symptomatic. And then we may have gone through enough of the population that need to be tested. So there are multifaceted reasons or different reasons why it may have resulted in the low numbers.
Gotcha. I've been reading wonderful things about the Rutgers developed saliva test. When's it coming to our drive-through testing center?
We're not totally convinced that that's the way to go. I've said before, it's not just a matter of the saliva that's in your mouth or on your tongue. You really have to have enough sputum or phlegm, and you have to fill up a tube. So we have one of the top epidemiologists who used to work for the state of New Jersey as our health officer at the county. And so it's not necessarily a test that we're looking to bring. So now that the 2 FEMA sites are offering testing for both asymptomatic and symptomatic residents, it wouldn't be as advantageous.
I have a general answer to this thing about testing. You hear about testing, you hear it on CNN, or even there was active testing in Middlesex. It can be a very long way from it being proven in a lab, but even a long way from it going from 1 or 2 test facilities to massive testing, availability, et cetera. So, the news is doing their job and reporting these things out there, getting them to market, and just can be very, very difficult.
Especially in mass.
Well, Middlesex County seems to be able to do it.
And that's what I alluded to. In 1 or 2 sites, it can happen. Yes, they do. And yes, they target it out, but that doesn't mean that it's available out there in large numbers.
Okay, anything else, Bill?
I do. When is the health department, what's his name, Dr. Raza?
Dr. Reddy?
Reddy, I'm sorry, Dr.
Are you talking about the county? Yeah.
Yes.
What was your question?
I was wondering if Dr. Reddy was going to make herself available to the press.
Dr. Reddy is doing her job. So if she's an employee, she's in staff, she can make a statement, possibly send you a written statement. But right now, her job is to make sure she's doing all that she can to keep Somerset County safe.
No, I'm sure Dr. Fauci in Washington is doing the same thing, but he seems to have time to talk for 2 hours.
Yeah, and he has a larger staff.
Bill, you understand exactly Dr. Fauci's job description and her job description?
Mr. Mayor, this is my question. Can I please ask it?
And I'm answering you.
I'm not that question, Mr. Mayor. I'm asking the freeholder director.
Right. So to that point, Dr. Fauci has a larger staff, and his role is a little bit different than our Dr. Reddy, slightly different.
Questions for Dr. Reddy. I have not even had the consideration of response to say, I'm sorry, I'm not talking to you. I have had nothing.
No, stop it.
That's my
Anything else, though?
You have something to say, Mr. Mayor? Right ahead.
Duly noted.
Thank you to Bill and PJ from the Franklin Reporter and Advocate. Now I'm going to open questions from the Facebook feed for the panel. If you have written a question before, you'll need to retype it.
So I have the questions that were mailed in as the time.
Oh yeah, if you haven't addressed those yet,
I might address some of the other questions.
go ahead, Mr. Mayor.
So we have Mr. Vornlocker, you were going to answer these. Why? There's two questions about drones.
And there's several on the Facebook feed.
Why and under whose direction are the use of drones being considered as a tool for enforcing the social distancing and other orders and or policies of the Franklin Police Department? And where were these prospective drones purchased and under whose direction?
So I guess I'll start with the beginning. So we were never looking, and this was an idea that came out of the command staff of the police department in a meeting with our public safety director. Drones were being utilized by the city of Elizabeth to, as they were flying the drones have an audio component to them, and they were using it to send a message to people to remind them to continue to social distance. They're not being used by the police department for enforcement purposes. And in fact, the idea came out of the fact that our fire department, Fire District number 1, owns a drone that has this capability, and it would have been the fire department that would have been operating it in wide open areas of a park to remind people to social distance. It was never intended to be used as an enforcement tool. There are a number of very valid reasons why a police department or a fire department would own a drone. The reason why our fire department owns a drone is for search and rescue purposes. Certainly the police department could own one as well. Drones are used in the investigation of fatal motor vehicle accidents to do accident reconstruction. There's a number of law enforcement purposes for them, but the police department doesn't own one. We're not looking to contract with some service. This was going to, and we were going to approach, and we actually did approach the fire department to see if they would be willing to go out with their drone and utilize it in open space areas that were generally inaccessible to the police officers and police vehicles, to give people the reminders, the constant reminders to not to gather in groups and to practice social distancing. We're not going to do it. It was an idea that was floated out by the command staff and the public safety director. So I think that's
Manager, I'm taking the questions off the feed in order. So we had a question, and you've addressed this in previous meetings, but just in terms of when people might expect restrictions on contracting and home improvements in their homes that are of a non-emergency nature.
So you're saying, when will they be able to do that? That's covered by the governor's executive order. So it's up to the governor.
Yep. Okay. Thank you. Sorry, moving down. You addressed the drones. And for Dr. Ravalli, can the music instruments be collected by the bus that's delivering food to the bus stops? So I guess the question is, how will the instruments that are in the possession of students be returned to the district?
Well, yeah, we are finalizing the plans, but what we anticipate, because, we only make certain stops, and those stops are about 30, 32, I believe we're up to now with food. That covers certain portions of the town. that are not in the vicinity of the schools where we're serving food. I don't know that that would work, but we have delivered computers that way. We've created bus routes for delivering hotspots that way. I don't anticipate doing that just yet. We're, depending on the number and the vicinity of where those instruments are and how many we absolutely need back, which is what we're finalizing. There may be a common drop-off spot by grade level, spread out over many days, because we're not in a rush, but we do need them back sometime over the summer so that they can be ready to go for next year. So I would anticipate there'll likely be a common drop-off spot spread out over a very large period of time in a very organized way, and only for those that we absolutely need back.
Okay, thank you, Dr. Ravalli. There's a question regarding, and this may be a state level.
Utilities?
Yeah, utility
You're
relief.
not going to answer that one. So the executive order, the governor has ordered through the Board of Public Utilities that all utilities, cable TV, telephone, electric, gas, water, sewer, all utilities, if are not allowed to be shut off during the time of the emergency. So I saw that, and that's covered by executive order.
And I'm not sure if there's someone on this panel that can address this, but in terms of young people, really anyone who's been, in isolation in their homes and apartments with mental health issues and other issues, and the kinds of supports that may be needed.
Well, I can answer that. At the county level, we do have resources that are available. While our offices may be closed to the public, we definitely have support for those with mental issues. We have PESS, the PESS hotline, as well as Richard Hall. Certainly, and the PESS number, I'll get that number for you shortly, is available for 24/7 support.
And also, Michael, I'd just like to add that there's on that hub for the township website is resources for mental wellness that lists all the links, including those that the freeholder director just mentioned, as well as state links, emergency hotlines, and all of the like, should someone feel stressed and need to speak with someone.
And as the husband of a school counselor who supports children, staff, and parents, I am sure that Dr. Ravalli might be able to share some of the supports provided.
Well, I can certainly share that our school counselors are active, our school assistance coordinators are active right now. So, and we're also partnering, I mentioned this last week, we partnered with Rutgers Behavioral Health, and Rutgers Behavioral Health, in a similar way to PES, we will have therapists that will be ready and able to work directly with our students through Rutgers Behavioral Health. That partnership begins on May 15th. We're finalizing some details with regard to our final MOU, if you will, and on the 15th, going forward, they'll be working with us, and they'll be announcing to our families how, in fact, they are going to be able to help us and support our students now and through the summer and all of next year and going forward, hopefully. So more information on that next week after the partnership is finalized.
And if you go to mayorkramer.com, search down, and you'll find a link. It says, "My child is in crisis. What do I do?" Click on that, and there's a graphic with things you can, with links and contacts you can make.
Okay. Mr. Mayor, there was a question that, and one, I wanted to say that I appreciate you all taking all questions via email or from the feed. There was also a question that came via email about voting by mail. And if you don't have a printer, and how do you get a hold of a hard copy, that kind of thing. Did you want to answer that?
Right.
Oh, there it is.
My screen being shared. Okay. So we'll get this up. Will being Michael. We'll get this up on the Facebook page.
Already there.
If you count, oh, okay. If you contact the county clerk, and here's a phone number, a fax, a mail address or an email address, contact them in any way. and say, I would like the application for mail-in ballot, then they will send that to you. How do I, how do I unshare? Big trouble.
Um,
Can you?
why don't,
So, Mr. Mayor, while you're looking to unshare, that emergency number for psychiatric help, 24/7 number is, the services is PESS, PESS. That number is 908-526-4100. Again, that's PESS for psychiatric emergency, PESS 908-526-4100. And a big shout out to Dr. Ravalli. You and your staff are doing a wonderful job with this distance learning. As a grandparent to an elementary school student in the district, it's almost like I'm back in school assisting, but also the resources that you have available on the Board of Education website for resources within the township as well as the county. So kudos to you and your staff.
Thank you.
Okay. And I believe that takes us to the end. I just wanted to mention real quick that I know that, there's a lot of people struggling out there who are unemployed at this point, which certainly our greatest sympathies go toward. But I just wanted to share my appreciation for everybody on this panel who's working very hard all day long, including Congresswoman Bonnie Watson Coleman, and still was able to come on to a 7 o'clock call to help inform the township residents. It's now 8:40, so it's an extra hour and 40 minutes at night, answering every question from every avenue. So as a citizen and resident, I really deeply appreciate everyone's time, including our friends from the press. So thank you for that. But Mr. Mayor, if you want to.
So there was one other mail-in question. Why are the questions?
Case in point.
Why are the mail-in questions? Why are these questions being sent to an unsecured Gmail account? So this is not a township meeting. This is a town hall meeting. It is not, what was the word you used, Mr. Manager? It's not a township sponsored.
It's not sponsored by the township. It's sponsored by you and Michael Steinbrook.
Right. Just as Mr. Ravalli is not part of the township, the press is not part of the township. There's not a quorum here. We don't have to have a public session. This was actually the brainchild of Michael to reach out.
Multiple people, actually.
Well, yeah, that's
including
true.
Bill.
That's true. That's true. Absolutely. Bill gets credit for this. To reach out to the people and be able to provide information. So it's not under the usual Oprah, etc. I do want to thank, before I forget, Jessica Sullivan, who has been part of the team and is putting up commentary as we go. And she was helpful in getting this set up. This all would not have happened without Michael at every level. Although he does drive me crazy with the technical details sometimes, I still thank him very much for it.
And the mayor has never driven me crazy.
And at every meeting I can, I talk about Mr. Bornlacher is just, I don't know if he sleeps. I know he's not sleeping well. He's working on things at every level, and he drives me crazy and I drive him crazy. Then we laugh about it and then we handle the next crisis. Those are the people I'd like to thank. I do want, we've lost 90 people, and I know the names of a few of them. When I commemorate these people, I am commemorating them specifically only because I know their names. Of course, Bodie Manzare, who is my friend that I knew quite well and was a leader in the town, and he is sorely missed. Alex Manzare is his cousin. He is also very active in the town from before when I got started, was on the planning board. He was actually one of the few people I know of that has been both a Democratic and a Republican committee member at one time or another. Recently, actually buried today, and I'll pronounce this wrong, forgive me, Alhaji Ali Badara Kamara. He's an engineer, but he was also just a kind and wise man, Democratic committee member, but just the nicest guy. There was Dick Barber, who was very strong in the church, and who I met many times and talked to many times, and sometimes we disagreed, but always was kind to me. Antoinette, not Antoinette, Antonia, and
Antoinette, she went by Tony.
Tony, Shadiq, Shadiak, who is a teacher, came to this country not knowing English, wound up teaching her parents English, and unfortunately died recently in one of our long-term care facilities. Margit Feldman was a Holocaust survivor, so she survived the Holocaust but was taken by this virus. She also did education about the Holocaust. She was a teacher in general. And after she died, sadly, her husband also was taken by COVID-19. He had run a doctor's lab, owned and ran a doctor's lab in Bound and they were married for 66 years. I think those are the names of all the people I know. None of them special, all of them special. And all of them special to people who love them, and they will be missed. First, before I forget, please fill out the census. We're in the high 60s percentile or percent of being filled out. It's going to be very important in the years to come about how much money we get. So please fill it out. And then a moment of silence. 90 people have died in Franklin, over 70,000 in the country. Behind Michael is a picture of the gazebo that has a light for everyone. Again, his and Alex Karazi's idea to have that. So if we could have a moment of silence for all of those who have died. Thank you. Last weekend, we felt that there was a bit too much, or a lack of social gathering at Colonial Park. So we're going to be adjusting the parking there. And there were problems with parking on the canal path. So we will be adjusting that. I was pushing hard with the state to allow for virtual weddings. The law until now had said that the wedding has to be done in the presence of the officials, so that's been made to virtual weddings. I suspect there are a lot of people who want to get married, especially for things like medical insurance because someone has lost a job. So at least this week, we're going to try to do a virtual group wedding so that I can marry as many people as possible. Not this week. I'm sorry, a week from tomorrow it will be. And if you want to, we'll put this up also. If you want to be involved in that, the number is 732-873-2500, the township number, and the extension is 6212, or the 6208 number actually will work just as well. And people can register for that. I want to try to accommodate as many people as possible. I am actually busier now than I have ever been as mayor. So I'm trying to do this as group weddings so we can get as many done as possible. That's what I have.
Mr. Mayor,
Yes.
just one thing I wanted to say, because we're never sure from week to week if we're going to need or going to have a town hall the following week. So we assess need, and so far we've had 7 of these. Maybe people want to leave some comments on your Facebook page about the value that they find in them. But one of the things that I just wanted to say that I mentioned before, but I just really appreciate the accessibility and the transparency that all of this panel and the guests that have come on here. I mean, it's been a great comfort and value to me, and I hear it all the time from people who've kind of come on to watch these things. So, can't thank you guys enough for doing it. Deeply appreciate it.
Okay. I think that's it.
Your signature sign off, sir.
Happy Mother's Day to all the mothers.
There we go. There's even better.
I'm looking for oh, here's my little gavel. Be well, Franklin.